I chose medicine as a career because I've been a patient in a hospital before, and being a patient in a hospital can be very difficult. Having physicians who are caring and able to explain what's going on is very important to me, as well as I'm sure to my patients. So I think that's what makes it very important for me as a physician to take care of patients. The most rewarding part about being a doctor for me is to engage with patients and their families. I think it's a very difficult time for patients when they're in the hospital, and it can be very difficult for families as well. Being able to communicate and explain what's going on with their care is important. I think patients being able to understand what's going on with their medical care helps them better understand their time in the hospital. I think all questions are important and should be addressed, but ultimately I think asking about how our treatment options are going to impact the patient's quality of life is something I wish patients would ask more about. While cancer care is important, quality of life implications are often undervalued, and I think asking more about how these treatments are going to affect the patient and their family's quality of life is something that we should discuss more. Also, as a member of the Sidney Kimmel Cancer Center, I wish patients would ask about clinical trials available to them. While we actively try to identify patients that would be eligible for national and international clinical trials, enabling patients to get novel therapies they otherwise wouldn't have access to, it helps when patients engage and ask about trials themselves. Clinical trials are an important part of cancer care in the United States and should be part of every cancer patient's treatment discussion. I'm Dr. Chandrasekar. My mission at Jefferson is to improve lives.